Welcome, everybody. My name is Margot Walters. I am the Audiology Advisor at ACSLPA. Welcome to today's webinar, and thank you for joining us. A few housekeeping points before we begin. The webinar is being recorded and will be made available to you via our website. And a reminder that we ask attendees to avoid using AI meeting assistants during the webinar. Please note the disclaimer on the slide, and that while we aim to provide accurate information, that errors can occur, and registrants are responsible for reviewing and familiarizing themselves with the relevant information contained in legislation and ACSLPA's other official documents. Today we will be reviewing ACSLPA's new advisory statement, over-the-counter hearing aids or OTCs, and professional obligations. The link to the advisory statement is on the slide and is also available on the ACSLPA website. We'll be looking at what are OTCs, the regulation of OTCs, the Health Professions Act and OTCs, ACSLPA's role when it comes to OTCs, and then moving into the guidance in the advisory statement, which is around client-centered service and informed choice, audiology practice considerations, and then risk management. If you have any questions following the webinar, please reach out to ACSLPA staff using the Contact Us form on the website. So let's begin with what are OTC hearing aids. OTC hearing aids are air conduction hearing aids that amplify sound into the ear canal and do not require surgical intervention or hearing healthcare professionals' involvement. OTC hearing aids are intended for use by individuals 18 years of age and older to help with perceived mild to moderate hearing loss and are considered direct-to-consumer hearing devices. Just a reminder, it is ACSLPA's position that over-the-counter hearing aids are not intended for and are inappropriate for use by individuals under 18 years of age. ACSLPA recognizes the risk of harm from pediatric use of OTC hearing aids. For more information, please refer to the ACSLPA over-the-counter hearing aids and pediatric position statement. The link is on the slide and it can also be found on ACSLPA's website. When it comes to regulating OTCs, Health Canada regulates both OTC and prescription hearing aids and classifies them as Class 2 medical devices. Class 2 medical devices carry a moderate level of risk. A medical device license is required before they can be sold in Canada. The approval process includes attesting that the product meets safety, effectiveness, and quality standards, although just a note that there are no acoustic or amplification-specific requirements. Individuals can submit problems or concerns with an approved medical device to Health Canada. Examples of concerns can be around effectiveness, clarity of instructions, and harm or potential harm. The number to report to Health Canada and the link to the reporting form is on the slide, as well as in the advisory statement. So who can dispense OTC hearing aids? The Health Professions Act provides legislative guidance on a regulated member's area of practice, authorizing health professionals in Alberta to perform restricted activities, such as inserting or removing devices beyond the cartilaginous portion of the ear canal, and inserting into the ear canal a substance that subsequently solidifies. Providing devices, including OTC hearing aids, to treat auditory dysfunction is not a restricted activity. Therefore, individuals who are not regulated members of a health professions college may fit or dispense OTC hearing aids in Alberta. So what is ACSLPA's role when it comes to OTC hearing aids? ACSLPA's role is to regulate the practice of audiologists and speech-language pathologists to ensure that there are adequate standards for competent, safe, and ethical practice, and to monitor and address concerns related to unregistered individuals who use protected titles or perform restricted activities when selling or fitting OTC hearing aids. So let's have a look at the advisory statement. The advisory statement starts with an introduction, giving background on OTCs, looking at licensing, regulation, governing laws, and the role of the college. It then moves into the practice guidance under three main umbrellas. So there's client-centered services and informed choice, audiology practice considerations, and then risk management. So let's have a closer look into client-centered services and informed choice. The first area under this umbrella is around collaboration. Regulated members are expected to involve and collaborate with clients in all decision-making related to service provision. This includes those clients who are using or considering using OTC hearing aids as an intervention. It is the regulated member's responsibility to serve as an educator and an advocate, when appropriate, by liaising with the client, their families, and other professionals. They should know and be prepared to explain their scope of practice and the suitability of various hearing healthcare interventions. In the area of informed consent and decision making, informed consent is required prior to any screening, assessment, or intervention. Clients need to be made aware of the potential risks, benefits, and alternatives for any proposed service or intervention, including interventions chosen by the client, such as OTC hearing aids. It is a requirement to clearly and accurately document discussions, recommendations, explanations, and client decisions. It may be prudent for regulated members working with clients using or considering using OTCs to establish formalized or tailored consent procedures that ask the client to acknowledge and to accept their understanding, the recommendations and potential risks or the limitations that were discussed, and the decision to proceed. Notably, limitations may include those of the OTC hearing aid. In the area of counseling, education, and advocacy, regulated members have a professional and ethical responsibility to provide balanced, evidence-informed education and counseling to clients regarding hearing healthcare options, including OTC hearing aids, using a client-centered approach that respects individuals' needs, values, and goals, and supports informed decision-making. Audiologists are well positioned to provide guidance on the regulatory framework in Alberta and Canada and clinical considerations with respect to OTC hearing aids. This is aimed at promoting transparency, supporting informed decision-making, and educating the public in understanding the appropriateness of OTC hearing aids for their needs. The next umbrella of guidance is around audiology practice considerations. In the area of assessment and intervention, a regulated member's clinical judgment and ability to accurately analyze and interpret information to determine an appropriate diagnosis or intervention is supported by accurate and comprehensive assessment results. A thorough hearing assessment ensures safe, effective, and individualized care, supporting the identification of underlying conditions, appropriate intervention selection, and avoidance of misdiagnosis or inappropriate device use, thereby enabling best clinical judgment and optimal client outcomes. The regulated member may recommend completing an audiological evaluation in the interest of providing quality, safe, and ethical service, and to avoid misdiagnosis or inappropriate amplification and management. The reasons why the clinical evaluation is necessary and all clinical considerations, including the client's priorities, associated fees, and the potential outcome of the evaluation, such as the OTC hearing aids being unsuitable, need to be clearly communicated and documented prior to proceeding. The next area of in audiology practice considerations is around competence. Clients and families may ask audiologists to work with OTC hearing aids or with manufacturers that they are unfamiliar with. If an audiologist determines they lack the competencies to provide safe and competent service for the client, they should disclose their concerns and may limit their practice and/or discontinue the services. This could be a temporary or ongoing measure, and as the regulated member develops the necessary competencies, these services may be introduced. When it comes to fees and billing, providing professional service and clinical expertise to clients with OTC hearing aids who request support may be reasonably and justifiably billed for. Fees for OTC hearing aid related products or services must be fully disclosed, including assessment and intervention, reports, equipment, and any other associated costs, and consented to by the client prior to service delivery. The last umbrella of guidance is around risk management. Looking at the area of safety, regulated members should adhere to safe equipment handling practices and infection prevention and control standards when working with clients and OTC hearing aids. Equipment used when working with OTC hearing aid is also subjected to maintenance and calibration requirements. Lastly, in the area of adverse events and reporting, medical conditions and contraindications to OTC hearing aids use need to be appropriately identified, managed, and documented, including referrals to other healthcare providers as required. A regulated member needs to respond to adverse events in related to a product or equipment where they may be involved with a client using OTC hearing aids. Adverse events may include over or under amplification, device malfunction, technology performance issues, inappropriate use, manufacturing defects, and so forth. While an audiologist may not be directly involved with the cause of an adverse event, they have an ethical responsibility to address issues of concern which may have an impact on the well-being of clients. The number and link to the reporting form are in the advisory statement and are provided on this slide. That's all. Thank you for attending the webinar today. If you do have any questions, please reach out to ACSLPA staff using the Contact Us form on the website. The link is also on the slide. And then if you could please complete our post-webinar survey by scanning the QR code on the slide. The QR code and the link to the survey will also be emailed out to you following this webinar. Thank you very much.